And I too am calling in from the traditional and unceded territories of the Musqueam, Squamish, and Tsleil-Waututh nations. So I want to first acknowledge that I am an uninvited uh, settler here. Today, I want to talk about wildfire smoke and indoor air quality, just touch on low-cost air quality sensors and how we are leveraging them at the BCCDC and how they kind of generally are being used to address wildfire smoke issues. And then I'll talk about this project that we have going in some detail and highlight a study that we recently published that investigates indoor air quality at childcare facilities. And then I'll also touch on some of our work in long-term care facilities where we have our sensors deployed. And I'll get into all those details in a minute, but thank you everybody for your interest in this topic. There was a recent, jumping right in, there was a recent report from the Lancet that really demonstrated that wildfire smoke events are increasing throughout Canada, throughout many parts of North America. But in particular for Canada, they found that wildfire smoke increased 220% over the past 20 years across all of Canada. And that between 2018 to 2022, Canadians were exposed to at least 2 days of very high or extremely high wildfire danger. And so these are increases from previous decades. There's also a new report out that focused on the US, but these numbers are likely translatable to the Canadian context. By 2050, the researchers estimated about a 76% increase in the number of deaths attributable to wildfire smoke. So we can see that climate change kind of currently is already having impacts, but into the future, more impacts from wildfire smoke are expected because as a climate change driver. And many of you are, obviously aware of what happened in Canada last year in terms of record-setting year for wildfires across the country, including in British Columbia here, where I'm based. So this graph is just kind of showing you the total wildfire emissions throughout all of Canada, but this is the red line is showing you 2023 and how extraordinary it was. And that black line is showing you this kind of long-term 20-year mean of wildfire emissions. So these are not direct measures of smoke, but these are the emissions when these wildfires take place. So these are satellite data, but you can see how dramatic 2023 was. So, not to say that every year is going to be like 2023, but we should be prepared for, events similar to what did happen in 2023, if not worse. And when we think about wildfire smoke, even wildfires, the direct impacts of wildfires, we have to think about which populations are exposed. We have to think about which populations are sensitive to the impacts of wildfire smoke and which communities actually have the ability to adapt when wildfire smoke occurs. And so when we combine these different factors, we have what's called differential vulnerability. So what we mean is that some communities are likely to be exposed to wildfire smoke more often. And then some populations have people who are more sensitive to the effects of wildfire smoke, such as older populations where they're more susceptible to having adverse respiratory health effects from wildfire smoke exposure. And when we say adaptive capacity, we simply mean having the ability to reduce your exposure to wildfire smoke as one example of adaptive capacity. So the project that I'm going to talk about today is really trying to get at the center of this Venn diagram, which is differential vulnerability, try to identify which care facilities are highly exposed to wildfire smoke. And these are dealing with sensitive populations, children and people under long-term care. And we're trying to investigate which facilities actually have the ability to mitigate exposure to wildfire smoke. This is a map of British Columbia. The different colors are indicating, where in British Columbia there's high impacts versus low impacts of wildfire smoke historically. And so this was from some air pollution modeling done by Nam Paul, who is a data scientist with our team here. And he's developed this CanAwesome model, which does a good job of predicting fine particulate matter across all of Canada. And this map is depicting days with, so the dark red areas are places that have much higher levels of wildfire smoke impacts over the past decade or so. And blue areas have had fewer impacts. That being said, while some places in BC have lower impacts of wildfire smoke based on the kind of the algorithm that Naman used in developing this model. These impacts are still large relative to the rest of Canada. So BC, and Alberta tend to have the largest wildfire smokes in Canada, wildfire smoke impacts in Canada. So the reason why I'm showing you this map is we generally know which populations kind of are in this lower left-hand corner, this more highly exposed. So our project does include these areas that have really high levels of exposure, but also includes areas with lower levels of exposure. I also want to highlight this graphic that I made up. And this is not meant to be an exhaustive list of public health measures and what what are the key ingredients, but this is what I see as some of the more important things that we need to make sure we're bringing to bear in public health when we're kind of putting out guidance or developing programs and policies. Is they should be evidence-based, they should be very well targeted, they should involve communication that is effective. They should bring to bear public resources and public support and really involve partnerships. And the project that I'm talking about today really does try to run this whole spectrum of key public health ingredients. And so I think as I go through the talk, it will become apparent how we're trying to generate the evidence in a targeted way for sensitive populations and kind of develop communication strategies or effective communication for these sensitive populations. And we're partnering with a lot of care facilities throughout BC here. Before I get into that, I do want to emphasize that while this map that I'm showing you here is related to outdoor fine particulate matter and therefore outdoor wildfire smoke impacts. The reason why this project is focused primarily on the indoor environment is because Canadians do spend about 90% of their time indoors. There's variability around that. Some people work outdoors. Children tend to spend a little bit more time outdoors playing, ideally. But just keep in mind that the vast majority of time that people spend is indoors, whether it's at home, where they work, where they go to school, or in the context of this project, what care setting they're at. Are they in a childcare setting? Are they in a long-term residential care setting? People spend most of their time indoors. And the reason why that's important is some of the wildfire smoke that happens outdoors infiltrates indoors. And so what happens when there's a sharp increase of wildfire smoke outdoors, there tends to be a sharp increase of wildfire smoke particulate matter indoors as well. And there's multiple factors that go into making that happen. So aside from just particulate matter spikes outdoors infiltrating indoors, there's also sources of indoor emissions of particulate matter. There's ventilation, there's air filtration. All of this really does play a role in the amount of particulate matter indoors. And there's also meteorological factors that do play some role, although that tends to be more important in the ambient environment. So the whole point of this slide is just to emphasize the point that, when we're thinking about wildfire smoke, we have to think about what's happening indoors, who is exposed, when they're exposed, and how much they're exposed. Another thing to consider is that all of our public health messaging really does center on the indoor environment. We tell people remain indoors, keep windows and doors closed if you can when there's visible smoke out or when there's an air quality advisory. We also encourage people to use air filtration, to avoid physical activity outdoors, to avoid emission sources indoors. So if a lot of our public health messaging is about the indoor environment, we really need to understand or ask the question, how safe is the indoor environment, particularly for sensitive populations? Is this good, sound public health advice? And that's one thing that our study is trying to kind of understand a little bit more. Um, I do also want to highlight another similar study that was done in Washington State, where they analyzed indoor and outdoor fine particulate matter concentrations using low-cost sensors. And I'll mention what I mean by low-cost sensors in a bit. But what they did is they compared infiltration of outdoor PM across different building types. So they looked at schools, they looked at commercial type buildings where there's businesses operating, and they also looked at residential buildings. They also evaluated the effectiveness of using fan filter units to reduce indoor PM in some residential buildings that were a part of their study. One of the key findings that they drew from this study was that schools tended to have much higher infiltration of wildfire PM 2.5 from wildfire smoke. So what that means is a higher fraction of fine particulate matter is entering indoors compared to commercial or residential buildings. They also found that the correlation between outdoor PM 2.5 and indoor PM 2.5 was also higher. So that does suggest that in school facilities, the PM 2.5 that people are exposed to during wildfire smoke events generally reflects what's happening outdoors. And then, whereas the commercial residential, there may be other sources of PM 2.5 driving people's exposures. But it does raise the question of, okay, in these types of settings and childcare settings, you could say are maybe similar to schools in some ways. What is the level of infiltration, and what is the wildfire smoke impacts indoors in those environments? And a reason why we would be concerned with children is they are a susceptible population, and they also have some unique vulnerabilities compared to adults, right? So children, their lungs are still developing, they're still growing, therefore their immune system is not fully developed. They tend to have a higher breathing rate than adults. They tend to breathe more through their mouth, and therefore ciliary action in the upper respiratory system is going to be less effective for that population. They tend to be closer to the ground. And another thing to consider is that there's prenatal exposure. So pregnant women, when they're exposed, also the developing fetus is exposed. Also, children, when they go to school or they go to childcare settings, they're generally outside of the control of their parents. And so and they also don't have as much ability to intervene compared to an adult on reducing their exposure. They also tend to spend more time outdoors. They tend to be a little bit more physically active when they're outdoors. So all of this really does add up to, the fact that we need to be understanding in care settings when children are away from home, what is their potential exposure to wildfire smoke when these events do occur. I also want to highlight there has been a recent systematic review published on the health effects of wildfire smoke for children and adolescents. And so what I want to point out is that respiratory related impacts show the most consistent adverse association with wildfire smoke. There's already strong causal evidence for PM 2.5 or fine particulate matter as having respiratory impacts on human health. But just to point out that PM 2.5 from wildfire smoke does also have similar type of evidence in terms of children with asthma being more at higher risk for asthma attacks when they experience high exposure to high levels of wildfire smoke, bronchitis, upper respiratory infection are also implicated for wildfire smoke, particularly actually upper respiratory infections. And now I want to talk about, just briefly touch on the residential long-term care context. You know, Canada has an aging population, therefore these long-term care types of facilities are not going away anytime soon. There's a large number of them throughout Canada. So that means, there's this older population that tends to be congregated in these care facilities in large numbers. These folks tend to have high prevalence of comorbidities, including respiratory and cardiovascular disease, kidney disease. These are all diseases we would be concerned about in terms of saying that these are sensitive populations. So that's one reason why we decided to include in our indoor-outdoor sensor project these residential long-term care facilities. Now I want to touch on low-cost sensors. So there's a large burgeoning movement of using low-cost sensors for measuring air pollution, for measuring temperature, wind. What's really interesting is these sensors can measure multiple air pollutants. They can measure CO2, they can measure fine particulate matter, carbon monoxide, other gaseous pollutants like nitrogen dioxide. These are all pollutants and environmental stressors that we would want to measure when we think about climate change impacts and wildfire smoke impacts. And there's the main benefit for these low-cost sensors is, I should take a step back and mention that most air pollution monitoring that has, and most of our research in the past has relied on kind of reference grade, high cost air monitoring instruments, whereas low cost sensors, just as I'm implying by calling them low cost, the cost of these are much lower. And what that enables us to distribute these sensors over a wide geographic area with higher density of sensors, or sensor nodes, you can call them. Whereas reference grade monitors, there's a patchwork throughout Canada, but there's large gaps in where we can measure. So with the low cost sensors, we can get a localized picture or understanding of air quality, and in particular when wildfire smoke events happen. These sensors also provide data in real time. So rather than providing you hourly values or daily values, they can provide you minute by minute average concentrations of fine particulate matter or whatever pollutant they are measuring. And then some of these sensors can actually be mobile. You can display them on mobile devices, or you can move around with the sensors. So there's a lot of benefits to using these sensors. And they've really been kind of, I wouldn't say wholesale adopted in public health, but they are being used much more often in public health. But there's a lot of drawbacks to using these sensors, and our project is trying to grapple with these drawbacks of the sensors. First of all, there's no health standards for these kind of minute level averages. So it's difficult to communicate what is the health risk when there's PM 2.5 is elevated for 5 minutes. That doesn't really translate well in a public health context. And so we try to deal with that with the way we analyze our data. These devices need to be tested over long periods of time to ensure their accuracy or be more confident about their accuracy. So we deal with the accuracy by correcting the data, and I'll talk about how we do that. And then there's a problem of data overload. These data can be really hard to interpret. You can imagine a value every minute in multiple sites can be difficult for an individual to interpret. And so we try to, in the study, demystify what all these data points actually mean. And I want to point out the whole point of our project is to do what's called crowd sensing or crowdsourcing of air pollution. If we can deploy these sensors in multiple places where there's a lack of air monitoring, we can involve people or citizen community participation in the process, there's a lot of opportunity to analyze data that we previously couldn't have access to, and to also involve people so that we can improve understanding of air quality information. And one example of using low-cost sensors is there's the AQ map. So this was developed by the University of Northern British Columbia, and the AQ map displays not just regulatory air monitoring data from Environment and Climate Change Canada, but they also display purple air sensor data. They also display air quality egg sensors that we have in our network. So people can now go to this AQ map and see in real time what is their air quality like throughout most places in Canada. And this is much more representative coverage of air quality if we only relied on just the Canadian Air Quality Network than the National Air Pollution Surveillance Network. So you can see, while there's still gaps in where we are currently measuring using low-cost sensors, these sensors can fill a lot of spatial gaps and improve our understanding, improve messages around wildfire smoke impacts in specific communities. So now I'll just transition to, well, what does our sensor network look like? Where is it? What types of facilities are they in, and what are our next steps? So right now we have approximately 50 care facilities that we have these deployed at. What we've done is we have what's called air quality eggs, and they cost about $1,000 a piece. And we have one installed indoors and one installed outdoors at each of the facilities that are a part of this network. Most of the facilities are childcare facilities. We have about 44 that are involved. And then 4 of them are long-term care facilities. And right now, our sensors are located in Interior Health, Northern Health, Vancouver Coastal, and Island Health as well. We actually have ongoing expansion of the network into Fraser Health, where we're collaborating with folks in Fraser Health to hopefully get put these sensor network expanded into cleaner air spaces. So, and I'll talk more about why we might want to do that later on. And in the Yukon territory, we're also collaborating and extending the network up into that space. But this map is showing you the local health authorities, like which ones have a sensor. So each of these pink areas are places that, or LHAs that have a sensor or indoor-outdoor sensor paired at care facility for our network. And so the air quality eggs are what we're using for this project. We could use other sensors, and just to point out that we're not advocating one sensor over another. That's not the point of the talk today. But we are using what's called air quality eggs. They use the same type of internal sensor that you would see in a purple air sensor. But one advantage that we have with this project is the indoor sensors. We can also measure carbon dioxide, which is an indicator you can use as a proxy indicator of ventilation. But the device measures PM2.5, temperature, humidity, and pressure as well. And we get that information in real time. So every minute we have a measurement of each one of these parameters. And again, we have one located indoors and outdoors at the same facility. Another thing we've done in this project to kind of foster community participation is rather than us doing the traditional thing of going out ourselves and installing the sensors, we actually developed materials and sent the sensors to the facilities that agreed to participate. And they went ahead and installed them themselves using our instructions. We told them how and where to install them in ways that will provide quality data and for us and for them. In addition to the installation instructions, we also developed an app. So you can kind of think of it like an air quality data dashboard for a care facility. And what this allows the facilities to do is to look at their air quality in real time. We've corrected these values to account for bias measurements of the PM2.5 sensors. We also show them temperature, humidity, carbon dioxide, and give them some kind of indication of what is the infiltration of outdoor air pollution to indoors, so that they can understand, okay, when a wildfire smoke event happens, how is my facility being impacted? And then there's some AQHI information to help people interpret the data so they can make informed decisions. In an ideal scenario, that's how this app would inform each facility that's participating. This gives you an example. They can click on, they can look for any date range that they're interested in, and they can look at the indoor and outdoor PM 2.5 levels over time, or up to the current day. And there's AQHI information that they can use to understand, okay, if I'm in the dark red zone, I need to, perhaps I should be doing something here. And you can see this particular facility, the indoor levels were just the same as what was happening outdoors, tracking almost a perfect correlation. So the study that we just recently published, it was really phase 1 of this project, what we call the Indoor-Outdoor Sensor Project. And what we did is we analyzed the indoor and outdoor PM 2.5 data from these low-cost sensors that were and we specifically analyzed the childcare facility data because that's where we have most of our study sites. We estimated the relationship between outdoor PM and indoor PM 2.5, and we use this modeling as a proxy for infiltration of outdoor PM into the indoor environment. And then we compare infiltration on days that were impacted by wildfire smoke versus days that were not impacted by wildfire smoke. We also do have a phase 2. So Health Canada, I should mention, is funding all this work. And so they've funded a phase 2 where we are developing an indoor PM 2.5 exposure model using machine learning methods to help us understand on a wide population scale, what is the potential impact to wildfire smoke in the indoor environment. We're also estimating ventilation, and we've designed and have implemented a survey to understand occupancy, protective behaviors, and building characteristics, and I'll touch on that towards the end. I do want to mention we've done a number of data processing steps. I won't get bogged too much down in the details, but there are some important things to note about this study. Is we limited the data to the wildfire wildfire smoke season of 2022, and we only analyzed data on Mondays through Fridays from 8 a.m. to 6 p.m. And the reason for that is these are time periods where we would expect children to be present. We don't want to analyze data on the weekend because there's different occupancy, different building characteristics, behaviors that just don't translate well to understanding children's exposure. We also did we developed an algorithm or implemented an algorithm that removes indoor peaks of PM 2.5. In other words, we have an algorithm that detects if indoor air pollution is rising relative to outdoor air pollution, which suggests there's an indoor source of PM 2.5. And so we censor that data from the analysis. And then we have an algorithm that identifies days that are impacted by wildfire smoke using the measurement data that we have. We also do another QA/QC measures. Again, as I mentioned, these sensors, these are low cost, so there's some concerns over the bias that they may have. So we do side-by-side comparisons of a sensor that's going to be deployed indoors and outdoors together. And we make sure that they're providing very reasonable, similar measurements. And so we have some simple laboratory tests we do to ensure that is the case. We constantly monitor these monitors, right, to make sure that they're continuing to collect data and that in the way we hope. And then we correct the measurements that are output from the devices using a correction factor from the US EPA. I won't get too bogged down into the details, but just know that we do what's called linear mixed effects regression modeling, where we say, how does X, which is measurement of PM outdoors, how does it relate to Y, which is PM 2.5 indoors? So we just develop these models and we kind of control for potential confounding factors such as meteorological conditions, whether it's a commercial or residential type of building design. And we account for indoor and outdoor factors that could kind of confound the relationship between wildfire smoke getting indoors. So now I'll jump into the results. Something that I think is worth highlighting here is, these are box plots. So on the x-axis, we see the distribution of PM 2.5 in our study period. So these are different categories of outdoor PM 2.5. And on the y-axis is a ratio of indoor PM 2.5 concentration to outdoor PM 2.5 concentration. And I want to emphasize that this is really important finding. What we see is that as outdoor PM 2.5 conditions worsen, as air quality gets much worse, when smoke starts rolling in to communities, or at least where we've sampled, the indoor environment becomes much less reflective of what's happening outdoors. So the indoor-outdoor ratios, when it's low PM 2.5 outdoors, is closer to 1, whereas when we get to really high outdoor PM 2.5, or when smoke is occurring, the indoor-outdoor ratios are much smaller. So just a fraction of that smoke is getting in during wildfire smoke events. And this finding, so this is just the same graphic you've seen, has been observed with other studies using low-cost sensors. So a study in Seattle, Portland, using purple air sensors found that indoor-outdoor ratios went down as air quality worsened. Another study that was for the entire United States using low-cost sensors with purple air also found that as PM 2.5 is worse outdoors, the infiltration decreases substantially. That being said, despite us finding that wildfire smoke infiltration is lower on wildfire smoke, we still see an absolute increase in indoor PM 2.5. So the graphic on the upper left-hand corner is showing you on days that are impacted by wildfire smoke, we see an over 200% increase in the concentrations of PM 2.5 indoors. On days impacted by wildfire smoke, for outdoor, we also see a 200% increase. So while we do see this kind of infiltration decreasing during wildfire smoke events, there's still, in terms of absolute concentration of PM 2.5 indoors, it's still relatively high and still of concern, which kind of raises a whole new set of questions, which we can talk about if you want. This is just showing you another key finding from the project. Try not to get confused by all the data points here, but just note that each one of those black lines that is increasing, it shows you the relationship between outdoor and indoor PM 2.5 at all of the different facilities. And so you can see there's wide variability in that slope. So what that means, one place might have a fairly flat slope, say that 10 times fast. Okay. Some place might have a flat slope, meaning there's a very poor relationship between outdoor and indoor PM, whereas some places might have a very steep slope. And so we would interpret that as places with a steep slope have more infiltration, places with a flat slope have less infiltration. And so since there's so much wide variability, we might want to wonder, well, what is causing that variability? When we try to adjust for potential confounders in this relationship, virtually nothing changes our estimates of the relationship for each facility. So, it really means there's a lot more questions to ask to characterize the reasons why we see this variability. We also see that infiltration on wildfire smoke days, the infiltration tends to be higher on wildfire smoke days at what we classify as commercial facilities versus places that we classify as residential facilities. And so we don't know why this is why this is the case, but it is rather intriguing, and we hope to be able to understand that in our research moving forward. Finally, well, not finally, I still got a little bit more time here. uh, I want to highlight this study from the University of Washington. They did a really, really good job of testing these what we call filter fan units or DIY box fan filters, Corsi, Rosenthal boxes. There's many different words people use to describe this. But basically, it's a low-cost way to have a portable air filter inside of your home or school or childcare or long-term care facility. And what they found is that, so the graph on the upper right-hand corner, as air pollution during wildfire smoke events stay high outdoors, when they start using these box fan filters, they find that indeed the levels of indoor PM tend to go down drastically, whereas outdoors it tends to stay the same. And one interesting finding is the graphic on the lower right-hand corner is showing you for these smaller size fractions, those are really what's dropping. And the reason why that's important is those are the fine particulate matter that are the smallest of the small, meaning those are the particulates that can penetrate deep into the lungs and even go into the blood through the alveoli and blood and gas exchange. So these fan filters are not only just removing PM, they tend to be removing the finest size fractions. And I will just comment that BCCDC has some material that folks can look at about DIY box fan filters. If you're running a child care facility or you're at one of these long-term care facilities, you can build these yourself. The National Collaborating Center for Environmental Health has recently published a really good evidence of the effective synthesis of the review of the effectiveness of these DIY box fan filters. And so this is something that I would describe it as more of a stopgap measure. It's not a solution, but it's something that is low cost that, if you imagine you're running a child care and you're just a residential type of care facility, this is something that could be a good potential solution to deal with wildfire smoke events. So to conclude on the findings of the project, so all of the child care facilities experienced wildfire smoke episodes during the study period. The minimum was 3 days during the study period, but most facilities experienced almost about 2 weeks of wildfire smoke during the 2022 wildfire season. We did find that the indoor environment provides some relative protection during smoke events. And so what I mean by that is about half of the PM 2.5 on wildfire smoke days is getting in. So there is some level of protection relative to what's happening outdoors. However, the indoor and PM 2.5 still did increase by about 230% on wildfire smoke days. So just simply going indoors and closing doors and windows is not a panacea. It's not going to be a cure-all to dealing with wildfire smoke indoors. And then we did see that infiltration attenuated on wildfire smoke days. And what I mean by that is that infiltration tended to decrease during smoky days. And we are attributing this possibly to behavioral responses to when these wildfire smoke events do occur. Although we do find that infiltration was more often higher at commercial facilities during wildfire smoke days. So this is not a straightforward story to be telling. And so we really need to understand this better. And finally, just to drive that point home, that last point I made is there's wide variability in the level of PM infiltration during wildfire smoke days. So we are attributing this to many different factors that we haven't yet fully studied in the project, which brings me to our next steps. What we've done is we have implemented a survey of the care facilities, the long-term care and the child care facilities. We're trying to understand how usable is the air quality app. Are they using it? Is it useful? Does it help their decision making? And then we're also trying to understand what are the protective measures that they're taking? What are the facility characteristics? Do they have HVAC? Do they have portable air cleaners? We're asking all of these types of questions that could explain this wide variability that we do see in infiltration across our study sites. Finally, we are estimating ventilation. We're trying to using the CO2 measurements. We are evaluating indoor air quality at cleaner air spaces during wildfire smoke events, and that's out of a collaboration with Fraser Health. And so we hope to learn a lot to inform public health messaging about cleaner air spaces and the decisions about when to activate those and whether to activate those. And then we're also trying to make improvements to our existing air quality app. And we're building a new app for specifically tailored to clean air spaces, which we believe will be beneficial for these cleaner spaces to help in their decision making. And I guess I'll just kind of conclude is a lot of my talk was focused on the childcare setting because that's where the majority of our sensors are located. But I do want to touch on some, we have some limited data of the residential care facilities, and I want to highlight something that is potentially of interest. This graphic is just showing you right here that the 2023 wildfire season had significantly higher levels of outdoor PM 2.5 compared to the 22 wildfire season. It's just kind of evident from this graph. But when we look at the indoor environment, we do find that for both the long-term care and the child care facilities, significantly higher indoor PM 2.5 levels compared to the 22 wildfire season. So what we see outdoors is translating to the indoor environment. So it's apparent there were larger impacts on indoor air quality from wildfire smoke during 2023. But the graphic on the right is showing you the indoor-outdoor ratios of PM 2.5 between 2023 and 2022. But one thing to just take note of is infiltration of PM 2.5 at the facilities in our study are very close to 1. This is still a little bit mystifying to us. And so the survey will hopefully help us understand what's going on at residential care facilities relative to the child care facilities, because you can see the indoor-outdoor ratios are quite different between these types of care settings. And so it's something we hope to be able to address. And I will go ahead and stop there. So thank you for listening.